year 2020. Right now, as the world faces more tyrannical rules, economical crisis, panic, and flood of misinformation. The headline of the Washington Times article from 28th April justifies this situation truly as, quote, coronavirus hype biggest political hoax in history, end quote. It reads, the new coronavirus is real. The response to the coronavirus is hyped. And in time, this hype will be revealed as politically hoaxed. In fact, COVID-19 will go down as one of the political world's biggest, most shamefully overblown, overhyped, overly and irrationally inflated, and outright deceptively flawed responses to a health matter in American history, and I guess in world history too. One that was carried largely on the lips of medical professionals who have no business running the national economy or government. But why do so many people, including doctors, scholars, Nobel Prize winners, and some of the media houses, are talking in this way? Although the mainstream media is projecting some different scenarios, selling fear and spreading panic to the world. In 4 months now of this outbreak, and nearly 5 million people have infected with this novel coronavirus. But the most important question right now is that how this all started. Is it natural? Is this a bioweapon or a manipulated one? Or some more sinister intent is hidden in all of this? So back in January 2017, this man named Dr. Anthony Fauci said that there is no doubt that Trump will face surprise infectious disease outbreak. And remember that he is MD of National Institute of Allergy and Infectious Disease (NIAID) and leader of President Trump's coronavirus task force. So you will think that this man is a genius or a visionary. But wait, the timeline of the events doesn't match up with this idea. Because following the 2002-2003 SARS coronavirus outbreak, NIH, National Institute of Health, funded a collaboration by Chinese scientists, US military virologists from the Bioweapons Lab at Fort Detrick and National Institute of Health scientists from NIAID to prevent future coronavirus outbreaks by studying the evolution of virulent strains from bats in human tissues. Those efforts include gain-of-function research, which is accelerated viral evolution to create COVID pandemic superbugs and hence bat-borne COVID mutants more lethal and more transmissible than wild COVID. In simple words, they are creating more deadly strains of these bat-related coronaviruses so that they can prevent future pandemics. But in October 2014, they were nearly missed releasing this virus in the world, so President Obama halted the funding for this project. But NIAID continued their fund to now Wuhan-based laboratory for their project as per the leaked documents from Daily Mail. Fauci's studies alarmed scientists around the globe who complained, according to a December 2017 NY Times article, that, quote, these researchers risk creating a monster germ that could escape the lab and seed a pandemic, end quote. Dr. Mark Lipschitz of the Harvard School of Public Health's Communicable Disease Center told the Times that Dr. Fauci's NIAID experiments, quote, have given us some modest scientific knowledge and done almost nothing to improve our preparedness for pandemic, and yet risked creating an accidental pandemic. So you can clearly see that the reality is not what they are trying to make you believe in. And it also goes with everything they are telling you. For example, one of the most important questions is that how deadly is the new coronavirus? The answer is simple. From the Washington Post, COVID-19 is a real disease that sinkens some, proves fatal to others, mostly the elderly, and does nothing to the vast majority. That's it. That in a nutshell it is. But how? It's simple if you look for the right data. John P. Ioannidis, a professor of medicine and epidemiology at Stanford, published an article entitled, quote, "A Fiasco in the Making. As the coronavirus pandemic takes hold, we are making decisions without reliable data," end quote. In the article, he emphasized that there is simply not enough data to make claims about reported case fatality rates, and that the projection that the World Health Organization and London Imperial College were making do nothing but cause horror and are simply meaningless. This has become much easier to see how, and the early models that were predicting over 1 million deaths in multiple countries have, as a result of COVID-19, changed and drastically failed, and were clearly way off by a lot. Those predictions also led to a massive amount of hysteria and panic, and the perception that COVID-19 is more dangerous than it actually is. The world-renowned epidemiologist from the CDC, Center for the Disease Control, Natwitowski, is saying this from a long time, and guess what? His video from YouTube was taken down recently because YouTube believes that whoever is going against World Health Organization is violating its policies. I mean, seriously. And for the numbers they are adding every day, right now it's looking like the numbers of infected is higher, and also the deaths due to COVID-19, because it is miscalculated and it's actually lower than what they are showing. The researchers suspect this is the same case globally in many countries. If this is true, that would drive the case fatality rate even lower than what the researchers predict in their study above. The New York Times states that approximately 3,700 were added to the death toll that was simply presumed to have COVID-19 without even being tested. They just presumed that they have died from coronavirus. And you can see this because if you consider every death in COVID-19, then it would be endless, and it's impossible to get out of this situation. For example, see the Russia's figure. They nearly have 285,000 cases and just have 2,600 deaths. Why? Because they are only aiding those whose primary cause of death is COVID-19. And if you think that this lockdown is helping to decrease the transmission rates, and that's why the models are falling, then look for the countries like Taiwan and Sweden. When Taiwan didn't follow the lockdown guidance, the World Health Organization and several other people predicted that the Taiwan will see nearly 4 lakh cases. But guess what? Taiwan just have nearly 450 cases till now and only 7 deaths. So is this your model of prediction? Sweden had never in lockdown from beginning, though they have around 30,000 cases. And at the same time, UK, Italy, and the other European countries have nearly 250,000 cases, though they were in lockdown. Not even that, in Italy, the vast majority of the people, nearly 95%, who have died, have several other illnesses. And you can also look up for India. India is in lockdown from 22nd March. At the time, they have only 405 cases, but now they have nearly 1 lakh cases, with the positive rate increasing thoroughly. So on what basis they are presenting that the lockdown is the only necessary? You will think why I am seeing this as lightly, because there are more fatal pandemics happening in the world. But have you seen this nuisance at this time? And do you know every year flu kills nearly 500,000 people around the globe, though it has a vaccine? After all, let's talk about the best prediction makers, the people who have predicted this pandemic. And I think they can clearly beat Nostradamus and Baba Vanga combined. The Rockefeller Foundation. If you're a geek and do research, then you will surely have heard this name before. So in 2010, the Elite Families Foundation made a magazine called Scenarios for the Future of Technology and International Development. At the page 18, there is a chapter called Luxray. It reads, in 2012, the pandemic that the world had been anticipating for years finally hit. Unlike 2009's H1N1, this new influenza strain originating from wild geese was extremely violent and deadly. Even the most pandemic prepared nations were quickly overwhelmed when the virus streaked around the world, infecting nearly 20% of the global population and killing 8 million in just 7 months. The majority of them healthy young adults. The pandemic also had a deadly effect on economics. International mobility of both people and goods screeched to a halt, debilitating industries like tourism and breaking global supply chains. Even locally, normally bustling shops and office buildings sat empty for months, devoid of both employees and customers. The pandemic blanketed the planet, though disproportionate numbers died in Africa, South Asia, and Central America, where the virus spread like wildfire in the absence of official containment protocols. But even in developed countries, containment was a challenge. The United States' initial policy of strongly discouraging citizens from flying proved deadly in its leniency, accelerating the spread of the virus not just within the US but across borders. However, a few countries did far better. China, in particular. The Chinese government's quick imposition enforcement of mandatory quarantine for all citizens, as well as its instant and near hermetic sealing of all borders, saved millions of lives, stopping the spread of the virus far earlier than in other countries and enabling a swifter post-pandemic recovery. Don't you think that it's kind of same happening right now? And I think it's too old to predict with this much perfection. So what do you think? Is this a prediction or a plan? Same thing goes with Bill Gates. He talked about this in his TED Talk. He also tweeted and warned President Trump that there will be a pandemic. And not just that, after all of this, some media groups are inviting him to talk about vaccines and his views on this pandemic. Is he a doctor or a professor? No one is asking, but I will tell you, no. Simply no. He runs Microsoft, a software company. And guess what? YouTube and Facebook is banning people like Judy Mikovits, Nat Witowski, Dr. Ron Paul, and this list is endless. And I am not even considering here the freedom that you have to put your opinion. Bill Gates openly considered that he wants to vaccinate the world population, and for that, a recent petition asking for the US government to investigate the Bill and Melinda Gates Foundation for crimes against humanity, signed by over 500,000 people, shows that the activities of Bill and Melinda Gates are being looked at more closely by the public these days. However, this is not the first time that Mr. Gates has received criticism for his dodgy dealing involving vaccination policies worldwide. For more than a decade, Gates commits crime against the citizens of India and especially children of India. In 2014, an article that was published by the Economic Times of India titled Controversial vaccine studies. Why is Bill and Melinda Gates Foundation under fire from critics in India? Indian activists and doctors blames the Gate campaign for a devastating non-polio-active flaccid paralysis (NPAFP) epidemic that paralyzed 490,000 children beyond expected rates between 2000 and 2017. In 2017, the Indian government dialed back Gates' vaccine regime and asked Gates and his vaccine policies to leave India. NPAFP rates dropped precipitously. In 2012, the World Health Organization reluctantly admitted that the global explosion in polio is predominantly vaccine strain. The most frightening epidemics in Congo, Afghanistan, and Philippines are all linked to vaccines, one way or either. In fact, by 2018, 70% of global polio cases were vaccine strain. So why so much love on him by mainstream media and even by politicians, and banning the people who are professionals? Is this the way you deal in democracy? And now in USA, HR 6666, COVID-19 testing, reaching and contesting everyone, the TRACE Act has passed. A bill to authorize the Secretary of Health and Human Services to award grants to eligible entities to conduct diagnostic testing for COVID-19 and related activities such as contact tracing through mobile health units and as necessary at individuals' residences and for other purposes. And these kinds of similar bills will be passed in the major democratic nations in near future. In India, they have made an app for COVID-19. But now they are telling people if you don't have the app, then they can't go to work or even to do shopping. And not just that, it seems like the mainstream media is not even trying to question anything. For example, the CARES Act, HR 748, Coronavirus Aid, Relief and Economic Security Act, or the CARES Act. So when did the first case of the virus reported in Wuhan as officials? On 31st of December 2019. And when did this CARES Act introduced in the American Congress? On January 19, 2019, almost a year ago. Something is not adding up here for sure. And in talk of vaccines, Bill Gates is ensuring that he wants to develop RNA vaccines that will give you immunity to fight coronavirus. Two new technologies are in the COVID-19 testing pipeline as we speak: DNA and RNA vaccines. They have never been released for public use. DNA technology is actually gene therapy. Genes are injected into the body and they can permanently alter the genetic makeup of the recipient in unknown ways. RNA vaccines would carry the danger of triggering autoimmune reactions, meaning the body basically goes war against itself. The vaccine that is being trapped by the US government under its National Institute of Health through drug company Moderna has never been used on the public before. It is not licensed for public use. RNA vaccines and the technology they use are entirely experimental, and this is not the type of vaccines being rushed into existence in just 90 days. Rather than instruct people on how to improve their overall health or boost their immunity with healthy foods, quality supplements, and physical activity, the power are telling the world that the only way to survive the coronavirus crisis is to rush the development of vaccine and then inject every human being on the planet. And don't you think that World Health Organization should be freely investigated by the UN? And not just World Health Organization, even UN should be freely investigated, because the main funding comes from these types of foundation like Bill and Melinda Gates Foundation. And why the World Health Organization is not even considering the data about lockdown and mortality rate in different countries and different approaches, and are praising China for their strict actions. And the Madagascar president claimed that World Health Organization offered him $20 million to poison the drugs that they are using. But he told World Health Organization officials to leave his country, and same did the Nigeria. Though now there are nearly 62 countries who wants to investigate World Health Organization's pandemic response. So at the end, the coronavirus outbreak and the lockdown measures that have resulted from it have raised a lot of questions from the population regarding corruption, false information, and using fear or hysteria to drive the population into the acceptance of inappropriate measures. Has our fear and hysteria been manufactured? Have the measures that governments have taken come as a result of manufacturing our consent? Are these measures happening for reasons other than our safety? Are they really for our best interest? Or is something else going on here? Why are we being forced to comply? More big names are asking these questions and sharing their beliefs. Elon Musk is one of them, also Donald Trump, and many other PhD scholars, doctors, and even nurses. Edward Snowden recently expressed that the fear and hysteria are simply being used to increase surveillance measures and to heighten the national security state, measures that will remain long after the virus, just as they did long after 9/11. He suggested that governments should simply make suggestions, present science and evidence as to why they believe social distancing and isolation can help, and encourage people to follow but not enforce them. What's also suspicious is that opinions about the coronavirus are being flagged as fake news. One of the latest examples come from Dr. Ron Paul, who encouraged people to ask themselves whether this coronavirus pandemic could be a big hoax, with the actual danger of the disease being massively exaggerated by those who seek to profit financially or politically from the ensuing panic. This is not to say that this disease is harmless. Without question, people will die from coronavirus. Those in vulnerable categories should take precautions to limit the risk of exposure. But we have seen this movie before. Government overhypes a threat as an excuse to grab more of our freedoms. When the threat is over, however, they never give us our freedom back. Is this lockdown necessary? Is there something else going on here? Events like this coronavirus pandemic only serve the collective as they spark massive amounts of questioning and critical thinking from the citizenry. It simply serves the collective in the long run. As a result, it empowers the collective to take their lives into their own hands and not simply allow themselves to be forced into measures by government that seem to be unscientific and unnecessary. At the end of the day, I believe humanity will do what is right for each other, and what is right for each other in times like a major pandemic would be obvious. There is no need for us to constantly rely on governments and pharmaceutical companies to tell us what is and what isn't, what is right and what is wrong. It's quite clear that we can think for ourselves, and the more events like this happen, the more of us there are that will continue to think for ourselves and ask questions and challenge the status quo. It's simple. The more you drive population by force, the more you awaken the population to corruption within those who use force. Because at the end of the day, force should never be necessary. For me, and obvious many others, it's hard to see COVID-19 is ultimately indifferent from already existing coronaviruses, flus, and other respiratory illnesses. For example, did you know that metapneumovirus has been shown to have worldwide circulation with nearly universal infection by age 5? Did you know that outbreaks of metapneumovirus have been well documented every single year, especially in long-term care facilities with mortality rate up to 50%? 50%, yes. Did you know that human metapneumovirus infection results in a large number of hospitalization of children every single year? Did you know it has substantial morbidity rate, again in the elderly, but also among children as well? Did you know that millions of children every single year die of these types of respiratory illnesses because they lead to acute respiratory illnesses? Imagine if the other coronaviruses and respiratory illness that are more severe in some cases and arguably more infectious in some cases were subjected to constant monitoring and beamed out to the population every single minute. Could you imagine the hysteria? Could you imagine the fear? This is something you should think about. At last, I just want to tell that the power of the people is much more stronger than the people in power. So don't be afraid. Stay awake. Till next time, folks.